Hey, good optometry morning. So you have cataracts and now your mind is racing. You're wondering, what if it hurts? What if I wake up and I can't even see? What if something goes horribly wrong? Well, here's the surprising truth. Thousands of people share the exact same fears that you're thinking about right now. Hey, I'm Dr. Michael Nelson, your YouTube eye doctor, and today I'm sharing with you the biggest fears that people have before cataract surgery. But more importantly, I'm going to share with you how those fears compare to what really happens. So on one side, you have fears, uncertainty, and what ifs, but where you want to be is calm, confident, and clear vision after surgery. Well, this video is going to bridge that gap. So let's first of all talk about the fear of pain. So people say, I can't even imagine what it's like to get my eye cut open, and I am so afraid of what the pain is going to be involved in this surgery. But here's what really happens. Before surgery, there are a lot of numbing drops and local anesthetic that's used around and on your eye. And in addition, surgeons will either be using pain-free microsurgical tools or a specialized laser called a femtosecond laser. And because of these medications, technologies, and techniques, your surgery is going to be pain-free. Now, it's going to feel a little bit weird because you're going to see some lights and you're going to feel a little bit of pressure around your eye, but you're not going to feel any pain. So strange, but not painful. So now that we have the pain issue out of the way, what about being awake for surgery? So you may be fearful that you're going to be awake during the surgery. What happens if you blink? What happens if you move? What happens if you do something and you ruin everything? And this is probably the most common fear that we hear. But the truth is, you're going to be awake, but you are going to be very, very calm. You see, in addition to all the anesthetics that you're getting, you're also going to be getting a sedative. And that sedative is going to make you feel like you're in a dream. So it means you're going to hear everything and you're going to be able to respond to the team's instructions and coaching during the surgery. And you're going to be super relaxed and you're not going to be able to flinch or make any sudden movements. It also means after the surgery, you're going to kind of remember what went on, but it's going to kind of be like you remember a dream. And in addition to that, they have some specialized instruments that help keep your eyelid open so you can't even blink even if you wanted to. And they also keep your eye super hydrated so it never dries out during the surgery. So you know that you're going to be very calm to the surgery, but another thought might be creeping in. What if something goes horribly wrong during the surgery? So I'm going to share with you about the fear of something going horribly wrong. But first, I want to ask a favor of you. I'm looking to gather some research on some of the specific pain points that you might be having before cataract surgery. And so if you might be able to spare a quick 10 minutes for a Zoom call with me, I'd love to hear about some of the things that you are worried or anxious about before cataract surgery. And if you're interested in doing that, take a look in the link in the description or on the pinned comment in the comment section and click the link. I'll get your information and then I can reach out to you and maybe we can talk. So what if something goes horribly wrong? What if I lose my eyesight completely, or if the lens that they put in doesn't even work in any way at all? Well, the reality is cataract surgery is the most common surgery that's done in the world. There's hundreds or thousands of cataract surgeries done in every single major city in the world every single day. And it's also one of the most safest procedures that can be done. In fact, there was a study in 2023 out of the UK that looked at the incidence of things going horribly wrong or people losing their sight completely after cataract surgery. And there was only 3 patients out of every million patients that lost vision significantly in one eye after cataract surgery. And all 3 of these patients, they had severely advanced glaucoma before they went into cataract surgery. So what that tells us is that the risk of severe vision loss is very, very low. And to ensure this, your surgeon is doing very careful planning. They use a sterile surgical environment and they do detailed follow-up care to make sure you have the best possible outcome. So surgery is safe, but another question people have is, what happens after surgery? So they wonder, how blurry is my vision going to be? How long is it going to take for me to end up having better vision after cataract surgery? Am I going to be function and see well after surgery? So here's the timeline. right immediately after surgery, basically 10, 15 minutes after surgery, and the rest of that day, your vision's kind of probably be a little bit cloudy and a little bit blurry. So it might be kind of like looking through a cloud or a piece of wax paper. And that's because of some of the swelling and the eye drops that they've used after the surgery. But the next day, your vision is going to be significantly improved. What you're going to notice is that things are going to be much, much brighter. You're going to notice colors are going to be much more saturated, and you're going to have much better contrast and clearer vision. It's definitely going to be much better than before the surgery. Now, the one thing that determines how good your vision is the next day is where you end up with your new glasses prescription. So the old glasses, that's likely not going to work for you at all. And you're going to have a new prescription, but it's going to take like 4 to 6 weeks for that new prescription to settle in and for you to get new glasses and then seeing really, really well. But for those first 4 weeks, your vision might be a little bit blurry, but it's definitely going to be much better than it was prior to the surgery. And so the other question is, okay, I know it's going to be better, but is it going to be as good as what I hoped it was going to be before the surgery? So a lot of people are fearful that they're not going to have perfect vision after cataract surgery. Well, the reality is cataract surgery will definitely improve your vision and improve contrast and improve brightness, but it may not make your vision perfect. There's a good chance you're going to need some type of glasses either for reading or for driving or a little bit of both in order to see really, really clearly. So you can kind of think of it like getting a new car. It's going to drive smoother, look better, work better than your old car, but it's not going to be some magical spaceship that you can fly to the moon in. So setting the right expectation after the cataract surgery is very, very important. Knowing what you're going to be able to see with and without glasses after the surgery is really important for you to understand. And there's a lot of options that you have to choose from, and I've got a whole nother video about that. And if you want to stay tuned at the end, I'll show you that video that you can learn about the options in lens implants for you. Now, some people aren't really concerned about needing glasses after, but they're a little bit concerned about what their independence and how soon they can get back to their regular activities after cataract surgery. So they're going to be wondering, what's going to happen if I've had one eye done and I'm still waiting for the other eye to be done? Am I going to be bedridden? Am I going to have to sit on the sofa? Am I going to be able to do my normal activities after surgery, and how soon can I do that? And this is especially concerning for those of you that live by yourself or those of you that are taking care of somebody else. Well, the truth is your recovery is going to be really quick, and you can get back to a lot of your normal daily activities the very next day. You're definitely not going to be bedridden. You definitely don't have to sit and do nothing. But what you do want to do is limit your vigorous activity for the next few weeks after cataract surgery. And that also includes doing any heavy lifting or bending over for prolonged periods of time. You're going to be able to walk around, you're going to be able to cook, you're going to be able to read, do a lot of your normal activities that you are used to doing almost right away. Now, the one thing you might want to plan ahead for is driving, because depending on what you need for glasses after the cataract surgery, you may or may not meet the requirements to drive a vehicle immediately after the surgery. So you may want to make that planning, but it's possible you might be able to drive a car. The other thing you want to think about is, do you have a restriction on your license that requires you to wear glasses when you're driving? Because after the surgery, you may not need that restriction anymore, but you should get that off, or at least get a letter from your doctor, so in case you don't get a ticket for not wearing your glasses. So you're actually going to gain some independence immediately after cataract surgery instead of losing some. But let's talk about some of the fears you might have if you have other eye conditions in addition to cataracts. So you might have glaucoma, macular degeneration, maybe diabetic retinopathy. So how is cataract surgery going to affect those outcomes? Well, the truth is those conditions might be affecting your vision, and the cataracts might be affecting your vision. And the tricky thing is that the surgeon can't really tell how much is due to cataracts and how much due to the other conditions. So it's a little bit unrealistic to expect your vision to be perfect if you have some type of eye condition, but it's definitely going to be improved. You're going to have improved contrast, improved brightness of the image, and definitely improved visual acuity. But how much depends on how severe the other condition is and how much is involved. And sometimes the doctor may not know that, because actually might not be able to get a very good view inside your eye before the cataract surgery. So that's an important conversation to have with your eye doctor, asking them, how much do you think my other eye condition might be affecting my vision in addition to the cataract? So I want you to be confident and calm and lose some of those fears that you might be having after cataract surgery. Again, if you want to reach out to me and have a conversation about some of your big pain points about cataract surgery, feel free to look at the link in the description and in the comments below. And if you want to watch some videos about some other things about cataract surgery, you can watch them over here. And with that, have a great optometry day.